We've talked a lot about the neck. We slouch, it compresses the nerves, the arteries, all the tissues around here, accelerates wear and tear and causes headaches. But it also has a knock-on effect through the rest of the spine. When I drop down like that, you'll see it will increase the curve in my thoracic spine. This can lead to kyphosis, which you'll typically see this kind of hunchback type position. If you keep loading this part of your spine, you are going to create pain and inflammation of the facet joints. This will probably lead to spondylitis, and you might actually get development of extra tissue here, and we call this a Dowger's hump. If you have that, it's almost certainly related to this forward head posture. As your center of gravity goes forwards from a forward head posture, a cascade of misalignments develop. When you increase the curve in one part of the spine, you typically decrease another. I'll give you an example. If we decrease the curve in the neck here, we tend to increase the curve here. And this is why people get a lot of spondylitis and pain if they have arthritis in their area. But likewise, as you increase that curve, it also typically puts more weight through the front of your lumbar spine. You actually flatten the lumbar spine. You're actually meant to have a gentle lumbar curve. It distributes weight evenly through the lumbar spine. And when we shift our body forward, it actually flattens the lumbar spine and creates a flat back syndrome. And this actually increases the pressure in the disc of the lumbar spine. So if you have had at any point sciatica, some form of disc bulge in the low back, you're more likely to have a flattened lumbar curve.